So I'm Monica. I'm trained in medical anthropology, and I work in a very specific part of public health, which is public health emergency management. Basically, how do we prevent things like disasters and epidemics, and if prevention fails, how do we reduce human suffering? I work in a very interdisciplinary group, a lot of medical professionals, so emergency medicine docs, infectious disease docs, nurses, immunologists. I'm like I'm the sole social scientist. And I'm kind of the one at the table that says, but what about the people? How do the people feel? What do people think about this vaccine? And so I think what I do is provide a balance to a more biomedical view of these instances of mass tragedy. And so it was through a focus on post-pandemic recovery as a holistic form of collective healing that I had run into Interfaith America and learned about Eboo Patel and all the great work that he and you do. And I thought we really need to engage with the spiritual community much more closely if we're going to deal with the human experience of an outbreak of infectious disease or a terrible natural disaster of the COVID-19 pandemic. But the acute crisis is relatively over, so to speak. But we haven't learned everything we can from this mass tragedy. And why I'm so interested in this conversation about faith and healing is because there are these incredible blind spots in the field of public health emergency management. Most practitioners are very operationally minded. All right, we've got a surge of patients at the hospital, what are we going to do? Or they're technologically minded. Like, how are we going to get a safe and effective vaccine produced quickly and distributed quickly? And those things are absolutely essential. But we're missing the more social and spiritual side to emergencies. And in particular with COVID-19, it has been an experience of mass tragedy, mass trauma, and a very, particularly in the United States, a very tattered social fabric. And we cannot talk about post-pandemic healing or recovery unless we deal with that aspect of people and their communities. So I'm glad the epidemiological curves tell us there are fewer cases, hospitalizations, and deaths. That's wonderful. I'm glad the national economy is bouncing back relatively well post-pandemic, but we have not dealt with these intangible collective wounds. And I think it's at this intersection of health and faith that we're going to find some answers and bring in people who are not the usual suspects. So that's why I'm excited about the conversation. In the spring of 2020, when hospitals were slammed by the number of COVID patients and there was a lack of personal protective equipment and issues of scarce medical supplies were real for people in hospitals. I partnered with a chaplain, Father Tom Domowski, who works at the schools of medicine and nursing at the University of the Incarnate Word in San Antonio. And I said to Father Tom, healthcare workers are under immense strains right now. What is it that a community can do to support healthcare workers in body and spirit? And so he and I wrote a piece together calling on communities to be there for their healthcare workers. It was about our responsibility to stay well, so we weren't making demands on them while they're trying to tend to people who could potentially die because of COVID-19. It was about our responsibility to interrupt transmission, by social distancing and the like. And also to nurture the spirit of healthcare workers because they were seeing some pretty dramatic things in healthcare settings. People who were dying who couldn't see their families, the possibility of scarce resources, and their fortitude, their spiritual fortitude really mattered. The ability to stick with the job of caring for people while keeping their hearts intact. And so he and I wrote about that. And that was one of the ways in which I've tried to draw on spiritual leaders to really show communities the way of dealing with things like a pandemic. So on the positive side, you may recall the outbreak of Zika that affected the Americas in 2015 and 2016, including some parts of the United States, but certainly not as drastically as Central and South America. And so I convened a number of focus groups to really talk to people about what they were or will not willing to do to help manage the spread of Zika virus by way of mosquitoes. And so I sort of anticipated people talking about scientific reasons. And what was really striking to me in those focus groups was when I posed the question of, would you be willing to put up with aerial spraying so we could kill adult mosquitoes? People didn't like that idea, but they were willing to put their personal opinions and feelings on hold if they thought they were taking care of their fellows in their communities. So I heard multiple times these very spiritual comments. I don't like it, but if it means protecting landscapers and construction workers who are outside all the time, that's important to me because, in the body of Christ, we need to take care of one another, and we need to be there for the lost, and the least. And that really just, as someone who works in public health, really just knocked me aside my head to say, look, there's this whole other way of talking about public health. And why aren't we listening to that and meeting people where they are as far as their worldviews? The downside, however, is in some people's minds, their destiny is in the hand of a higher being. And it's out of their control whether or not things are going to turn out well or go poorly for them in connection with a disease. So they may feel like, this is out of my hands. And while I am respectful of that perspective, I think having a dialogue with them while remaining respectful about that belief, while also introducing them to a positive public health intervention that actually can fulfill other parts of their value system, we need to have more of those dialogues. So in that case, a certain belief system can unintentionally throw up a wall to well-being. But I think that's on us as public health professionals to really understand what's really behind that belief and somehow become an ally to that belief system without denigrating a particular way of thinking about, for this person anyway, a higher power. So if you look at my bio sketch, I was taught in elementary school and high school by sort of social justice oriented nuns. And I think that's really stayed with me. And I was also raised by a nurse. And so I get that aspect of sort of the community side to healthcare work. I ended up in public health, and it's at the population level. I think just that community orientation, a social justice orientation, and trying to really appreciate people as a medical anthropologist, right, as whole beings who live and breathe and think and feel certain ways, and that can be many different ways. It's just being respectful about that. So I think as far as my personal, while I don't attend, religious services regularly, I think it's that spiritual focus on the whole person that informs my work most strongly.